Welcome to today's Explainer. Today, we're diving straight into the surprising root cause behind a whole constellation of frustrating physical and emotional symptoms that so many women face. It's a topic that touches a ton of lives, yet it frequently goes entirely misunderstood or misdiagnosed. Listen, if you've ever sat in a doctor's office feeling completely exhausted, only to be told that all your labs look perfect and everything is quote-unquote normal, when you know deep down it absolutely isn't, this explainer is for you.
Are you exhausted despite getting a full night of sleep? Are you waking up drenched in sweat in the middle of the night? Or feeling so mentally cloudy you can't even remember simple words? Well, these clues, along with sudden joint pain or really unpredictable mood shifts, might all point to a single hidden culprit. It's so easy for society, and even medical professionals, to just brush this all off as stress or a normal part of getting older. But let me tell you, these symptoms are profoundly real, they are incredibly frustrating, and they're all deeply connected.
So, here is our roadmap for today. We'll cover 1. The hidden hormonal culprit, 2. Estrogen's surprising body-wide roles, 3. What causes the drop, 4. Long-term risks to watch, 5. Natural ways to find relief, and finally, 6. Medical options and next steps.
Let's jump into Section 1, the hidden hormonal culprit, connecting the clues.
Low estrogen definitely doesn't just stay in one lane. It ripples through your entire body. We aren't just talking about hot flashes or irregular periods here. It actually affects your brain, causing severe brain fog and frustrating memory lapses. It dramatically impacts your emotions, triggering sudden anxiety or mood swings that can feel entirely out of character for you. It even breaks down the collagen in your body, leading to unexpectedly dry skin and thinning hair. This single hormone touches virtually every vital system in the female body, which is exactly why it is so easily and so often misdiagnosed as something else entirely.
Moving right along to Section 2, estrogen's surprising body-wide roles, more than just reproductive health.
Estrogen is literally the headline hormone in the female body. It acts as a vital protector for your bones, your metabolism, and the elasticity of your skin. It's actively involved in regulating your blood sugar levels and managing your cholesterol. You can kind of think of estrogen as the thermostat for your metabolism. When those estrogen levels start to drop, that thermostat basically breaks, and the body suddenly defaults to storing weight right around the midsection. This perfectly explains why you might notice weight accumulating around your abdomen during perimenopause, even if your diet and exercise habits haven't changed one single bit.
Actually, it goes even deeper than your metabolism. If you've been feeling unusually anxious, irritable, or just completely disconnected from joy, it's absolutely crucial to know that estrogen acts as a massive stabilizer for your brain's mood-regulating chemicals. It directly influences serotonin and dopamine production. So when estrogen drops, those vital neurotransmitters become highly unstable. It is honestly maddening how many women are handed a prescription for antidepressants by a well-meaning doctor, when the actual root cause is simply a dropping estrogen level destabilizing their serotonin.
It's also absolutely essential for your heart. Estrogen physically relaxes your arteries and provides critical cardiovascular protection. It does this by utilizing something called endothelial-derived nitric oxide. To put that simply, nitric oxide is basically the body's natural way of keeping your blood vessels flexible, relaxed, and open. Estrogen acts as the essential manager, ensuring that whole system works smoothly. When you lose that estrogen, your blood vessels lose that built-in life-saving flexibility.
All right, Section 3. What causes the drop? The usual and unusual suspects.
The natural transition into menopause is the most common reason for an estrogen drop, sure, but lifestyle factors can also completely shut down your body's estrogen production. If you're going through intense overtraining, experiencing severe chronic stress, or dropping to a very low body weight, your body actually perceives that it's in a famine or a severe survival state. In response, it smartly shuts down non-essential reproductive functions, taking your estrogen right down with it. Medical treatments like chemotherapy or radiation play a huge role too, as do underlying conditions like PCOS or thyroid dysfunction. Even postpartum breastfeeding suppresses estrogen because of the hormone prolactin.
Now, this is a crucial point. During perimenopause, your estrogen doesn't just drop in a gentle, predictable slope. It is a wildly erratic roller coaster. You could have your blood drawn on a Tuesday and be told by your doctor that your estrogen is perfectly normal, but by Thursday it is completely plummeted, bringing on severe brain fog, sleep disturbances, and hot flashes. The labs can completely miss the reality of what you're living through on a daily basis, and that is exactly why you must treat the symptoms you are experiencing, and not just blindly follow a lab test drawn on one specific day.
Let's look at Section 4, long-term risks to watch, why this is about longevity.
Here is a really jarring statistic from the WISE study. It shows that 69% of young women with coronary artery disease have low estrogen levels. Compare that to just 29% of healthy women. Remember how we just talked about estrogen acting as the manager that keeps your arteries flexible and open? Well, this data proves just how critical that cardiovascular protection really is. Without it, the risk of serious coronary artery disease spikes dramatically.
And it's not just your heart on the line either. 1 in 5 women over 50 in the U.S. are affected by osteoporosis. Without estrogen's protective qualities, women are at a massively increased risk for rapid bone density loss and fragility fractures. Think of estrogen as the foreman on a construction site, constantly telling the body to build new, strong bone. When that foreman leaves the site, the building stops and the demolition crew takes over. Your skeletal system is left highly vulnerable.
Okay, let's get into solutions. Section 5. Natural ways to find relief, starting with lifestyle. Incorporating dietary sources of phytoestrogens like tofu, edamame, flax seeds, and lentils can actually help gently combat some of these severe deficiency symptoms. Think of your cells as having tiny locks on them, and your body's natural estrogen is the primary key that opens them perfectly. Phytoestrogens are plant-based compounds that act kind of like a spare key you had cut at the hardware store. They aren't a perfect fit, and they aren't quite as strong, but they can still turn the lock just enough to give you gentle, natural, and really meaningful relief. You also really need to actively support your body's hormone production. Foundational minerals and vitamins like vitamin D, boron, B vitamins, and especially magnesium are crucial. But beyond vitamins, you've got to manage chronic stress. See, your body uses the exact same raw materials to make both stress hormones, like cortisol, and sex hormones, like estrogen. If you're constantly stressed out, your body basically steals those raw materials to make cortisol, leaving your estrogen production completely bankrupt. Pair that stress management with moderate exercise and 7 to 9 hours of quality sleep to actually recharge your system. Which brings us to Section 6, medical options and next steps, taking action for relief.
When lifestyle tweaks aren't quite enough, medical interventions like targeted hormone replacement therapy, or HRT, offer highly researched, direct relief for severe symptoms. And modern HRT is highly customized. It is absolutely not a one-size-fits-all pill anymore. Depending on your specific needs, age, and health history, doctors can prescribe estrogen therapy in tailored creams, patches, oral forms, or injections to minimize risks. There are also localized non-hormonal options, like vaginal moisturizers, to provide direct comfort exactly where you need it most.
Now, if you do go the medical route, you've got to practice patience. Finding relief is a marathon, not a sprint. Replacing these vital hormones takes about 2 to 4 weeks to begin dialing down the hot flashes, and it can take up to 3 full months for your body to fully utilize that estrogen to restore your bone and tissue health. It just takes time for the body to completely reset and achieve that full hormonal balance, so definitely give yourself the grace of time.
The absolute best way to get to the bottom of all this is through a functional medicine approach. Finding a practitioner who looks at the whole picture, deeply reviewing your unique symptoms, and running comprehensive testing that includes your thyroid is the difference between just getting a temporary band-aid and experiencing true healing. Thyroid dysfunction perfectly mimics so many symptoms of low estrogen, like deep fatigue and rapid weight changes, so building a personalized plan that accounts for everything is absolutely critical.
You know, you do not have to accept discomfort as an inevitable part of aging. You don't have to just live with the brain fog, the joint pain, the sleepless nights, or that deep exhaustion. You now have the roadmap. You understand the clues your body has been giving you, and you know the natural and medical options that are available. So the only question left is, are you ready to take the first step to reclaim your balance and truly thrive? Thanks so much for joining me for this explainer. See you next time.